I think one of the nice things when we had the expansion of the building is that we were able to provide a much larger area for their residents in terms of space. They have nice open windows now. Instead of being on the interior of the building, they have a fresh new look to their residential space that's sort of all their own. I think the thing I usually inform residents about is when you come to a rural community, you really become part of that community. Everyone knows everybody. So the idea of being anonymous, a lot of med students go to larger schools and larger places where they can sort of blend into the crowd. They don't expect to maybe see their patients or run into their patients. That's just not going to happen necessarily in a rural community. You're going to see your patients, you're going to interact with your patients more in the community setting, whether that's on a civic level, religious services. Again, you're going to see the people you take care of. So it's a little bit of a loss of you being able to sort of disappear into the crowd. But the idea is that you're able to come into that community and sort of embrace them and take them in. A lot of the training is very longitudinal and integrated over the curriculum. So, like our support services, BHCs are here, and it's sort of part of the natural process that you're going to work with these other support services, social work, care coordination. We have a pharmacy on site. They have the opportunity to pick up the phone and call a pharmacist or walk across the hall and talk to a pharmacist if they have any questions, about anticoagulation or renal dosing of medications. It facilitates those communications and that teamwork. So, those are basically always available to them. In terms of specific courses, it sort of just depends on what rotation they're on in terms of how those hours are funded, essentially adjudicated to that month. One of the other services we offer here is Connect Clinic. People struggling with addiction are sort of in all stages, and we're here to help and support them. And so opioid abuse is a huge national problem, and so we have a dedicated clinic called Connect Clinic that uses our space, and our residents have the opportunity to train and work with them because that's an important part of their training, because no matter where they go and train, opioid dependence sort of affects communities at large. So it's important that they have that training as well. Our residents spend several months of the year, more months as they're sort of further along in their training, working with our critical access hospital, which is Kittitas Valley Healthcare Hospital. So that hospital, as a critical access, has an ER, inpatient services, and we work primarily more in the family birthing side of it. But they do have the opportunity to work with other providers at KVH to take advantage of their experience and training. So they understand that working in a critical access hospital where you don't have as many support services, sort of training in terms of how to triage the patients to get them the appropriate care they need, whether that is here or if that is in a larger, more tertiary care center like Yakima or Seattle. So critical access hospitals are required to provide emergency services, and one of the big problems right now in rural access is actually obstetrical care. So I feel really strongly as a provider that training rural residents, especially in obstetrical care, is really important, because we're going to be sort of that interface between people to be able to have prenatal and obstetrical services when a lot of hospitals maybe aren't necessarily available in those rural communities. Ellensburg is a great choice for residency training because as a rural training center, you really have access to opportunities to serve the Ellensburg community, which is really like a hub and a nexus that connects a lot of larger communities. So not only are you going to see your bread and butter sort of treatment things for family medicine docs in a rural community, you're also going to see some zebras and exotic things that just happen to be passing through, because we're between Seattle and a lot of larger communities like Yakima and Spokane. So you're really just going to get great training here in terms of the diversity of cases, as well as the small family feel, great downtown, great places to eat, college right next door, a lot of opportunities to have fun and participate in outdoor activity and have a great time.